Delayed speech is a concern faced by many parents and caregivers. Knowing a little about speech development can help parents figure out if a child has a speech problem. When it comes to your child's speech development, many parents ask themselves, what is normal? Speech refers to the ability to speak and produce sounds and words correctly. Children with speech delays can use words, but you have difficulty understanding them. They struggle to speak because they have difficulty in forming words. Speech skills in an infant begins with the slightest cooing sounds, a combination of laughter and vowel sounds. As the months pass, babies eventually begin to babble, which soon progresses into speech. A typical 2-year-old can speak about 50 words and speak into 2-3-word sentences. By age 3, their vocabulary increases to as many as 1,000 words. Delayed speech, also known as speech delay, refers to a situation where a child does not reach the typical milestones in speech and language development at the expected age. Every child's development is unique, but there are general guidelines for when children should reach certain language milestones. If a child consistently lags behind these benchmarks, it may be considered as delayed speech. It is a common developmental problem that affects 10% of preschool children, but children take their own timeline to improve the speech process. Delayed speech in children is very common nowadays, and it is noticeable in various ways such as limited vocabulary, difficulty in the pronouncing words, difficulty in making sounds. Children may have challenges with understanding and following parental instructions, and they may have reduced interest in engaging in conversations. Some children with delayed speech may have underlying developmental or physical causes for delayed speech. It can be caused by many factors such as genetics, hearing impairments, developmental disorders, premature birth, limited exposure to language, or a combination of these factors. Delayed speech also mainly caused by oral impairment and autism spectrum disorder, or any neurological problems. By 12 to 15 months, if your child cannot clearly say simple words such as mom or dad, it may be the sign of delayed speech. So recognizing the signs of delayed speech is very important for an early intervention. Because an early intervention is often the key to helping children with delayed speech to interact with their peers and to develop effective communication skills. You may have to remember the key point that every child is unique and it is essential to provide a supportive and encouraging environment for them to develop their speech and language skills to overcome the delayed speech. Homeopathic treatment is a very good choice of treatment used for helping a child with delayed speech. In-depth case study of the child and the earlier homeopathic treatment started for the child for delayed speech are the higher chances of developing and improving their speech progresses. Homeopathy is a very safe and reliable method of treatment for delayed speech. So you can contact Dr. Sheela Homeopathic Healthcare Clinic at 9500049892 for delayed speech treatment.